Good afternoon. I'm Anna Osland. I'm the Director of Research at the Blanco Public Policy Center at UL, and we are excited to welcome you to our Lunch and Learn for Whole Health Louisiana. Whole Health Louisiana is a collaborative effort led by the Louisiana Department of Health as the public sector anchor and funder for the Whole Health Initiative, and the Blanco Center leads the plan's implementation and evaluation. If you're unfamiliar with what Whole Health Louisiana is, it's the state's cross-sector initiative designed to systematically address, mitigate, and prevent childhood adversity within our systems of care and support. We have Whole Health has 4 priority areas and goals: collaboration, awareness, workforce, and prevention and healing. With these priorities in mind, the vision is to build a state where children, families, and community members across Louisiana are healthy and thriving, regardless of who they are or where they live. All right, I'll be turning it over to Quinn, who will be the moderator for today's session, and we'll introduce our speakers. Go ahead, Quinn.
Thank you, Anna. Hi, everybody. I'm Quinn Nguyen. I'm a research associate at the Blanco Center and coordinator for the Whole Health Louisiana project. And I am monitoring today's webinar and all of our future webinars. As part of this initiative, we are holding a variety of different activities meant to raise awareness and deepen conversation about trauma-informed care practices. Our virtual Lunch and Learn series touches on the workforce priority area of the Whole Health Plan and features presentations from industry professionals and subject matter experts. With that, I want to quickly share my screen so you guys can see our lineup for our 2026 Lunch and Learn series. Let's see. Okay, can everyone see that? Okay. So real quick, I want to mention that we have our speakers lined up for 2026. So if you are interested in learning more about the future topics that we'll be talking about, this will be on the Eventbrite page that you all used to register for today's events. We have a lot of amazing speakers and topics that will be covered from January to June of 2026. So please look forward to that. And again, this will be on the Eventbrite page that you all use to register for today's event if you want to learn more. So before I introduce our speakers for today, I want to first mention our ASL interpreter. She should be pinned on your page to see the interpretation throughout. And if you're having trouble viewing the screen, just let us know and we will try to troubleshoot any Zoom issues that arise. In addition, if you are attending for CEU credits, don't forget to complete the post survey to receive your credits. So I'm gonna stop sharing my screen for a minute, and I'm gonna introduce our speaker for today, who is Stephen Phillippi, the Chair of Community Health Science and Policy at the LSU School of Public Health. He is also the Director of the Institute for Public Health and Justice and the Founding Director of the Center for Evidence to Practice, both working to bring evidence-based practices and supportive policies to states and local communities. He received his PhD from LSU, his MSW from Tulane, and a BA from Loyola, New Orleans. He is a licensed clinical social worker and clinically certified forensic counselor. He has a 30-plus year history of developing, managing, evaluating, and providing direct services. He is a full professor with tenure, teaching both master's and PhD students. Dr. Phillippi's most significant contributions to science to date are identifying needs and gaps in behavioral health and justice systems, creating policy and practice changes to support research-driven prevention, and developing translational methods to grow such programming to scale in a sustainable method. And with that, here he is, and he'll give his amazing presentation to us. So go ahead.
Thank you very, very much. And thank you so much for having me. Thanks to all of you that I can't see immediately on the screen. Just a couple of quick warnings. I am going to ask you to type in the chat. So lick the lunch off your fingers and type things as I call upon you. It's interactive. Um, Keep you interested and paying attention, hopefully. Um, and then people are going to notice I've got little slides on the side. It's purposeful. It helps me navigate and cut paste things in the chat as well. So thank you all for having me. Thanks for letting me interrupt your lunch. And I am going to make sure I leave time at the end for questions as well. So very excited to be here. I am curious, just see how well y'all chat and how well I can see it. Where are you at? How are you doing today? Good, bad? Someplace in between. Can't wait to get out of work. Looking forward to the holidays. Type it in the chat. It helps me know you're there. Perfect. There we go. New Orleans is doing well. All right. Working on data. All right. Doing great over here too. Thank you very much. Rayville's in too. Perfect. Okay. So y'all know how the chat works. There's going to be a lot more of this. Um, Julie, too cold, but doing well. Perfect. All right. Well, thank you for that. Now you know how this all works. So what creates pressure on you all as people, as professionals? Give me some ideas. What creates pressure on you? What stresses you all? Type in the chat for me. What creates pressure on you as professionals, as people? Handling crises. Thank you, Crystal. Limited money, resources, deadlines, constant deadlines, excessive workload, client load, finances, having too many irons in the fire. Perfect. Well, not perfect, but understandable. Inefficient processes. Oh my Lord, there's plenty of those too, aren't there? Reading the news, outcomes, and productivity. All right. So y'all are good human beings. Things create pressure. They stress you out. Not enough resources living day to day. All right. Um, so how do you know we're stressed? I mean, we know what stresses us. That's what y'all were writing, but how do you know you're stressed? And I'm just going to give you my example while y'all type in the chat. My example is, and I'm the worst at noticing it because I usually have many irons in the fire, way too many deadlines, way too many processes going on. But I notice it by the time I hit about the afternoon, and I can feel it all up here in my shoulders and in my neck. And I'm like, oh, this has been really stressful. So I'm usually the last to know it until I start feeling it. Um, but so thank you, Shabri. Tension, headache, irritable and snippy, eyes hurt, migraines, difficulty sleeping. All right. Not slowing down to take care of yourself, more snippy. All right. Very good. I really appreciate this. This makes it much more fun when y'all are participating. So this is what we know are indicators of distress, just some of them anyway, and several of them you all have already said. So physical headaches, stomach aches, emotional, that snippiness, that frustration, anger, personal, sometimes isolating, getting more cynical, right? Having a little bit more mood swings and irritability. And then maybe in the workplace themselves, just avoiding certain people or starting to be late or just missing things and just lacking motivation. So that's what we expect when people are in distress. So sometimes seeing this is believing more. And I'm just going to give you a couple of examples of people that may have been a little bit stressed. Here's Abe Lincoln. This is when 4 years from when he went into office, from when he was at the end of his office and unfortunately was murdered. Um, More recently, Barack Obama, he did that job for 8 years, and you can see he looks pretty worn out on the picture on the right. But stress impacts us, certainly physically, emotionally, mentally. Um, and so when that stress builds and we're not taking care of it, we're not paying attention to it, we're not paying attention to all those things that are saying we're pretty stressed out. We run the risk, of course, of compassion fatigue. Other words for compassion fatigue are like burnout and things like that. But we are working with people. I think somebody put in the chat too many cases, right? We are working with a lot of people sometimes in their very worst moments of life. And those things can accumulate in us as we are trying to work with people over and over, and it can have an impact on us. Uh, that constant exposure to troubles when we've got our own and they have theirs, and sometimes it just mounts and mounts. One account from what somebody had said in some of the readings is I never see normal cases anymore. I don't even know exactly what that means, but it kind of resonated with that thought of I'm overloaded. I have way too many things and way too many crises, irons in the fire, and it can all lead to exhaustion. So I'm going to read this to you. Usually I'd have somebody read it, but for the sake of time, I'm going to read this. And I want you to think while I'm reading this about the position of the person that might have said it. All right. So compassion fatigue or burnout is a result of vicariously becoming worn down and emotionally weary from hearing about and dealing with situations where people have been physically and emotionally injured, hospitalized, all too often killed. These are people who suffer on our watch, so to speak. These cases have a way of creeping into our lives, and that is only natural if you care about and are engaged in your work. In thinking about the subject, I've come to understand that these cases affect us in many ways. For me, the volume and nature of the cases can sometimes be overwhelming. Indeed, even one case can be devastating, and most of my colleagues can recall a profoundly tragic individual case, even though it occurred years ago. There's more. So the symptoms of compassion fatigue are fairly predictable. Some reported internalized symptoms, including sleeplessness. I saw that on the chat. Eating disturbances, increasing anxiety, depression, hypervigilance. Others reported external symptoms, including becoming increasingly angry, irritable, intolerant. Some of y'all said that in the chat. Some reported increased fearfulness, security consciousness, and inability to make prompt decisions or procrastinating when you know you have to make those decisions. Increased difficulty focusing, concentrating, felt quite ambivalent, therefore anxious about the critical decisions that you need to make that might even be close calls. While most people experience one or more of these emotions or behaviors at some point in their lives, the frequency and acuity of the symptoms seem to elevate when we are responsible for the lives of others. Greatest interest to me, this person that wrote this quote, was finding that compassion fatigue, that burnout, seems to peak at the 7-year mark. So being able to address it certainly becomes important. So this was a quote by Michael Town. I'm very curious in the chat if anybody can guess what his profession is. Or nursing, good guess. Social worker, good guess. All right, parent. He might be a parent, I don't know. ER doc. All right, so nobody's gotten it yet, so I'm gonna give you the answer because it's very interesting because I really think this highlights the whole issue that we're going to talk about these secondary stressors. Michael Town is a judge. So literally just sitting on the bench day to day, hearing these stories and the lives of others and making hard decisions. And he's recognizing how much these secondary stressors have an impact on his life. So you can imagine as a judge, and you all that have all worked in court systems know how removed judges can be, how much more this can also affect the nurses, the social workers, the parents, the ER docs, the counselors, the psychologists that you all listed in the chat. So this thing, vicarious trauma, sometimes also called secondary trauma, right? It's developing and reporting, right, your own trauma symptoms as a result of responding to victims of trauma. So it's secondary, or what we call insidious or vicarious. But it's literally being exposed to the stories of cruel and inhumane acts perpetrated to other people in our society, and it has an impact on us. And this is what we try to pay attention to. Probably the best thing, the unfortunate thing in my bio that talks about the 30 years that I've been doing this work. I wish I had been taught about this when I was in school. This was not something they were teaching social workers back in the 90s when I went through. So this is I'm glad people talk about it more. I'm glad the opportunities exist more to seek assistance, understand it more. But this is re-experiencing avoidance, numbing, persistent arousal that we usually associate with PTSD, with one big difference, which is it's secondary. You are not the primary person. You're not the person that experienced all this. You are experiencing it strictly through your work you do with the traumatized people that you work with. Um, Empathy has been identified as the number one thing that is associated, not the only thing, but when we look at the power of association of what causes or increases secondary trauma, empathy is one, and that's a kind of a problematic thing, since most of us are taught to be empathic. To do our jobs well, we have to be empathic. And we know empathy is very associated with this burnout and this compassion fatigue and the vicarious trauma. So you got to know what to do with that empathy. American Council Association, I think, says it very well. Emotional. This is the emotional residue of exposure from working with people, hearing their trauma stories, becoming witness to their pain, their fear, their terror, and the trauma survivors that they've endured. I think says it very well. So hopefully this is going to tell you how old I am. Only about 3 of you in the audience are going to laugh at that picture on the bottom right, but it's okay. So you may be asking yourself, do I have compassion fatigue or vicarious trauma? It's a great question. And if you know the Talking Heads, you know they asked it in their song. But there's a self-test. We're not going to slow down and take the test, but I am going to drop this link for you all. It's in the slide, but it's also on your screen now. That'll take you straight to a PDF on the ProQual. If you've never taken it, it is the professional quality of life scale. It's available for free if you are using it for educational purposes, and making sure you give credit to them when you use it. All their notes are at the bottom of the form. But it asks about the last 30 days. What have you experienced? And you get to rate yourself, and being honest certainly gets you a better, more accurate response on the details. But when you have a moment, you might want to take it, not necessarily right this second, but have that popped up on your computer so that you can take it later. What are you going to find out at the end of it? It will result in 3 scores. It's going to talk to you about compassion satisfaction. How are you doing? How much do you like your job? How do you feel about being effective? It'll also talk to you about burnout, depending on what the score is. And then it'll give you some notion of if you actually are scoring high enough to be concerned about secondary trauma. It's just a screen. It doesn't say you have it. Just says you're screening high enough that we would be potentially concerned about it, and it gives you some suggestions about what to do about it. We're going to talk about what to do about it. So red flags for vicarious trauma. When we get to that level of secondary trauma that we're experiencing from working with other people, we start seeing this in ourselves and the people we work with. Emotional regulation issues, start questioning our own self-worth. Are we effective enough, not effective enough? Like we said in that quote, that decision making starts going on. We're going to talk more about boundaries, so I'm going to skip that in a second. But our relationships start getting affected too, when we carry those issues and everything into our own lives and our own relationships, be it at work or personal. And we might start getting even emotionally detached. It's just an overwhelming world. It's overwhelming experiences with people that are experiencing overwhelming conditions. and situations. And so we start emotionally detaching, which is completely natural. None of this is saying that you are not good at your job, not good as a human being. It just simply means that your heart, your emotions are going to protect you from going too far, because that's what this is triggering, is a protective mode for your own safety. And that's why the detachment starts making sense. So how do we avoid this? How do we address it and or avoid it? Avoid it, certainly, to minimize it. If we're starting to hit vicarious trauma, that secondary trauma, what do we do to address it? There's a number of things that are out there in the literature. I'm just going to highlight a few. Um, but research, read, and apply. You got into this world and the work you do because of how smart you are, the research you've already done. So do that. Google it, look it up, look up the options. There's lots of information out there. But paying attention to your emotional overload. Don't go on autopilot. Don't go on no hope. We bring a whole lot of hope to situations. So walking around and feeling hopeless or that there's no hope is not a good place to be. This one account, and you can read the details for yourself, but I always find this interesting. When we start out in this field, a lot of times we want to talk about the details of the people and the cases we work with. And when you start hitting that secondary trauma, that vicarious trauma, you start realizing those details have a huge impact on you. And you might start leaving stuff out and start talking more broad scope about it, all out of self-protection, that you're not casting your brain and your emotional state right there in the midst of all of that deep-seated trauma and hurt, because it's having an impact on you as well. Boundaries. I'll show you my test of boundaries in a second, so hold that thought. But empathy, you can't not empathize in this business. So I'm not suggesting at all not being empathic, but also not internalizing others' terrible experience. I'm going to go to that in a second. I'm going to give you the simplest test on boundaries and that experience in a second. I know a lot of us can't control the cases that we accept, but certainly some of you can. And being just smart about that, knowing when you're overwhelmed, knowing when the number of cases or the severity of the cases that you are working with, the people you're working with, just managing that as best you can to try and limit it. Meditation, reflection, reading, prayer, all of those kind of things certainly help. Anything that separates you in the moment so you can be with you yourself, and not tied up. So here's my test for you. I'm going to patent this one day. This is what I call the Southern ceiling fan test. When you start talking about empathy, over empathizing, and not having those boundaries to separate yourself, I think this is a good way to be. If you're laying in that bed at night and you're watching that ceiling fan above your bed spin, and you're still thinking about the cases from the day, you're still thinking about the details of the trauma of the people that you work with and everything else, and you're not separating your life from theirs, so that you're living your life and recognizing that they are out there and they're struggling, they're surviving, whatever they're doing, but you have your life, and you're not having to overwhelm your own brain and thinking with the details of their trauma. That's when we start getting concerned. How do you detach? How do you keep your boundaries and keep that separation? So I think taking care of you becomes really important. Part of the whole process in this is making sure that all of these things we know happen. The title of this is about you being a superhero and also being human. And we appreciate the incredible work you do in Louisiana, and for the adults, the children, the families of Louisiana. But how do you take care of you in this? And so that becomes important. So here's that part where you get your fingers back going. So what do you do when you start paying attention to your needs, your need for self-care? I'm curious to hear what you all do or are doing or hope you would do. What do you do to take care of yourself emotionally, physically, recreationally, relationally, spiritually? Type it in the type for me. Type it in the chat for me. Sorry. Exercise. Thank you, Tamara. Get out in nature. Go ground self. I like that. Lots of research around both exercise and nature. So thank you. Church, go pray, vent, travel, delegate. It's a lot. Meditate, exercise, walks, spend time with your own grandkids. That's awesome. Burn wood in the fire pit, practicing detaching with empathy, getting a hot bath, favorite snacks. I like that. One of the things to note about snacks is when you're really, really stressed out, then your body tells you to eat more carbs and eat more salt. So just be careful about what those snacks might be. Um, Having relationships where you can be vulnerable and you're authentic. That's fantastic. Awesome. Um, Relaxing to drink and go out the front porch swing. Y'all are nailing this. I like this a lot. Church, music, band, breath work. Perfect. All right. So, so these are just some of the things, and y'all have said a lot of these, but taking care of you, some of the strategies that are out there, this is just a very short list of after looking at things that are out there in different articles and research. But I don't know that anybody said sleep. I may have missed it, but sleep is one of those things that can really help and certainly make a big, big difference is making sure that we're well rested so we can go in to do the hard work that we do. Eating healthy, exercising, physical touch goes a long way. We're human beings. We like to be touched. We like to be in relationship with people. Um, Emotional, making sure y'all said about having those good relationships. I didn't see if anybody said just cry when you need to, laugh when you need to. Make sure you give yourself lots of praise and humor sometimes can go a long way just to get you back to feeling like a human being, not caught up in all the trauma. A lot of y'all said about some travels and quiet time. I like the people that said they take walks. Uh, I won't even ask you to take a poll in the chat, but I'd be curious how many of y'all leave vacation time on the books. We're at the end of the year, and how many of y'all actually took vacations, your full vacation amount this year? Did you take 2 weeks off? Did you take 1 week off? I'm afraid to ask, so I'm not going to ask you to put that in the chat. Most Americans, unfortunately, leave a whole lot of vacation time on the books, and we know that from a lot of studies. And a lot of y'all mentioned the spiritual elements about praying and meditating and being part of community. Jill absolutely takes her vacation time. Thank you, Jill. So this is my early holiday gift to you all. Some of you all talked about being outside, walking outside. The studies on how much being outside in green space, and you get bonus points for blue space. It really has a de-stressing component to us. So I'm just leaving this up here for a few more seconds, and I hope you're starting to feel yourself calming down even more, de-stressing a little bit more. It's just your early holiday gift. All right. So what about self-care at work? We do these things for ourselves. What about work? What do we know that helps avoid vicarious trauma, helps avoid burnout at work? Training certainly helps. Training should equal skills. Skills should make your performance better. It should make the outcomes with the people you work with better. So training goes a long way. Not doing this alone, having peers that support you and that you can support uh, when we have those stressful incidents, when we are working on things, talking about what happened, how did we respond, could we have done anything differently that would have changed it for the better? Those are all important questions. I also think we shouldn't just do it in stressful incidents. I think also when we do amazing things and we succeed and it wasn't so stressful, but it was just successful, I think we should ask those same questions. What happened? How did we respond? What did we do right so we can repeat that over again? Um, Hopefully you have access to employee assistance or counseling opportunities if your self-care at work isn't enough. Certainly reaching out. I know a lot of organizations have spent a lot of time investing in more workplace wellness and having those services available for employees. But if they don't forget to use your healthcare benefits if you have them. But reaching out to people is important and professional help if needed. And then recognition and appreciation opportunities, recognizing the success in yourself, recognizing the success in your peers, becoming that kind of person at work that recognizes and is grateful for the successes that y'all are receiving and doing and accomplishing. Just a couple of other things from some of the articles out there about vicarious trauma and burnout. Observing the good in the world, just stepping away and making sure that you purposely start thinking about what is right in this world, not just what's wrong, but how can I take that view of the world that may be automatically, lots of reasons why it might be automatically negative, and just say, what is good? What is right now in this world? Be it something at work, something in your family, something in yourself, whatever. But trying to observe the good that's in the world because there is plenty of that, regardless of what the news says. Um, Being grateful, we talked about gratitude. Certainly, anything that you can do with gratitude goes a long way for your own self maintenance. And it also usually translates into very good relationships with those around you when that gratefulness extends to those people as well. Celebrate your intelligence. Y'all are smart people. You're doing this work for a reason. You earned it. You earned your degrees. You earned your positions. So celebrate your own intelligence and make sure that is recognized in yourself. And you got here for a reason. Um, Realizing your own emotions when you're getting raw. Can you walk away? Can you step away? Can you take a walk? Can you just take time off? I'm not sure about shopping sprees. Those get expensive, but that was one of the things that was suggested in the article. So, and then taking contemplative time. One of the things that happens with that vicarious trauma and the traumatic residue that sticks on us sometimes, it also increases some of our biases, um, uh, stereotypes, biases that naturally occur when we see situations that are repeated over and over again. And one of the best way to adjust out of bias is simply recognizing that they exist, and the best way to do that is to pause and think about it and have that contemplative time to really think about what is going on in this situation. What is mine? What is theirs? What can I do? What am I reacting to versus what am I responding to? Is it just emotional reaction, or am I responding because I have the skills to respond differently? Um, Somebody said drinking. I was glad that somebody said it before I said it. Somebody put it in the chat. But drinking to celebrate versus a tonic for stress, right? So hanging out with friends, having a drink, being social with friends and celebrating life and celebrating the good things around you go a long way, but just make sure that you're not using it as your elixir for stress. That is not the medicine to de-stress, but it can be good for social engagement and unwinding a little bit. Y'all said spending time with trusted friends in the chat. I saw that. Considering support. One of the things that we do know about folks that are resilient, we'll talk about that in just a second, is that people that are resilient, A, have other people in their lives, and B, know when they need support and ask for it. So considering and seeking support if this is just overwhelming, taking care of you in the other way. I do like this last point, so I'm just going to hone in on it for a second, but truly remind yourself that you were not the victim. It's not your situation. I know this whole series is about trauma in Louisiana, but these are not your situations, right? These are the situations of the people that you work with. they may look like the situations you've been in. They may really push buttons and remind you of things, but you can be compassionate, but you do not have to carry the pain for others. It's your job to support and hold space for that pain. Um, you're not taking their emotion away. This is their trauma to live, to figure out how to survive, and you're there to support it. And being healthy to hold that space to support it takes a lot, an incredible amount of a lot. So taking care of you to be able to hold that space and support is critical. So resilience, we've talked a lot about resilience. We've heard a lot about resilience over the last few years. I'm going to just hone in on a couple of things that I don't hear as much about. Um, one is resilience is not a individual skill. People that are resilient actually know how to connect with others and find support. Um, Resilience is, though, that belief that there is something you can do. And so this to me speaks more to how resilience actually takes place than some of the stuff that over pushes individual responsibility, that kind of Western mindset that you need to be resilient. You need to pull yourself up by your bootstraps. What we know is those that have two or more people in their world that they can connect with do much better than people that are isolated. So social support becomes important, but I want to remind you that there's four types of social support that we need. And some of us may have all four. That's what you need. It's rare that you find all four of these things in one person. So that's why it usually in the literature, you'll see that social support, when we talk about resilience, people have connections to two or more people, two or three people, two or four people in their world that they can connect with. Because it's rare that we get every one of these levels of support from one person. But you need emotional support, right? The person that's there, they're loving, they're compassionate, they are understanding, they're empathic. You need an informational support, the people that are there to make sure you've got information, guidance, webinars. Uh, Whole Health Louisiana connects you with resources and future webinars and all that kind of stuff. Instrumental support, concrete support. So who's going to be there when you need it? I always think about this is if you had a flat tire today going home from work, who would you call? That's instrumental support. It's the AAA that's going to show up, your partner that's going to show up, your trusted colleague that'll show up, your friend that'll show up and change that tire with you. Um, it's that tangible instrumental. And then the appraisal is the one that none of us like, but we all need. Just going to pause there because I meant to slow down. Appraisal support is literally that social support that we all need, but we don't enjoy as much. And those are the people that are going to tell you the truth. Those are the people that are going to say, Steve, you are really irritable today. I don't know what's going on, but something obviously is going on. You need people in your world that are going to hold you, ground you, bring you back, and note when things are going on and pay attention. So those are the four things we all need to be really truly resilient. Even the perception, this is the fascinating thing, I think, in the literature, is that even the perception of this kind of connection buffers stressor effects. So if you believe, you perceive that you have these connections, it actually will give you buffers. It's when you don't believe that you have these types of connections or you actually don't, that we start seeing stress levels go up. All right. So action continues to change everything. So I do believe we could talk about this all day, and that's really nice, but I think taking action is more important. So I just put this up here for you all to think about it, not necessarily to do. And I'm happy to share these slides, of course, with y'all. But taking time, what is going to protect you from burnout, compassion, fatigue, vicarious trauma? The strengths I bring to protect me, and that would go in this top box up here. But then where am I going to really improve? what can I do differently? What can I improve? I like this because of the 3 steps are really grounded in kind of more cognitive behavioral treatment work. But what specifically will you do to achieve that? How will how will you know the goal's been reached? But most importantly, how will others around me know that I'm doing something different? How will people experience me different because I'm doing something differently to take care of me? Um, so we're going to wind this down last few minutes and talk about workspace because we all work in environments. And the question is, are those environments helping us with all this stress or are they not? And there's some good research out there on this. This is just something from the Human Service Leadership organization that I ran into this work during COVID when there was a whole lot of stress, tension, and unknown. And I thought it was very impactful then, and I hope it still remains impactful. But yeah, when we start looking at the work that we do and where we are and what our work environments feel like, I thought they broke it down uh, pretty nicely. And the question of what do I want to be different at my work? What could we do differently at our work? And you contribute to that workspace. So what can you do differently in that workspace to make it less stressful, more hopeful? Um, and this is the first thing, which is the fear zone, which is what we try to avoid. But am I complaining frequently? Is this about a lot of fear and anger? Do I get mad easily? Those kind of things that fuel this much more kind of negative experience of work. The good news is there's 2 other zones that we can work for if we don't want to stay in that fear zone of work. And one is the learning zone, evaluating information before spreading it. I'm going to go back to my COVID example real quick. Um, the level at which people were spreading information without checking any facts during COVID, and I think we could say there's a lot of that going on now too. But really evaluating information. Do I need to send this? Is this factual information? Is this something I really believe in, or am I just kind of fearful that I'm not going to be seen as knowing things and getting the word out quickly, but evaluating information before we spread something that then later turns out to be false. Just being careful that we're not creating stress, and we can help that by evaluating the information we send out. Um, Recognizing that we're all trying to do our best and really trying to keep that mindset. I'm trying to do my best. I know my colleagues are trying to do their best, and start being a little bit less judgmental, um, and recognizing people are doing the best they can at the moment. And of course, we can all do better. Every one of us can do better, but believing that people are doing their best they can at the moment. Giving up what I cannot control. That is a hard one for a lot of us, but I think it makes a big difference when you start looking at your workspace. What can you control and what can you do differently versus what is not in your purview, and letting it go. So you don't take on all that additional stress that you can actually not do much about. Um, We've talked about identifying emotions. Certainly, your emotions carry into work. And then being aware of situations and think how to act. I said this earlier, but that's the difference between reacting and responding, right? Reaction is usually more emotional based. We need that in actual threats to our survival. When threats come, we need to be able to react. And we have those natural innate response opportunities or reaction opportunities. But a response is a little bit slower, right? A response is more contemplative. A response is saying, what is the story I'm telling myself about this situation? What are my biases? What are my issues? What am I bringing into this? How can I better respond and be there more skillfully than just react to the situation? And then ultimately, we'd love to all be in the growing zone. And I think all workplaces ebb and flow from this, right? Sometimes we're in the fear zone, sometimes we're in learning zones, sometimes we're in growth zones. But we'd love it if we spend the most of our time in these growth zones. Appreciate others. Again, I won't ask you all to do this in the chat, but I'm always I'm always mesmerized about how much all of us that are in these helping professions recognize that when we recognize things in others and we are grateful and we call out that gratitude. We recognize people, we attend to people, and we appreciate them for things. How much we enjoy it. But then once I ask people, so you've been at work and today it's 12:45, right? So 12:45, you've been at work half the day already, and I would love to know that everybody on here has already been appreciated at work. I'm guessing if we took a poll, it would be very mixed. But if you think about your work environment, how you can lower stress and make it a more adapted, healthy, well workplace, is just simply taking the time to recognize what other people are achieving and what they're doing well, and making sure you recognize the accomplishments and appreciate those around you. We love it. And guess what? Our colleagues do too. So being verbal about it and making sure you let them know. Looking for ways to adapt to new changes. Change happens all the time. So being adaptive is one of those resiliency traits. We've talked about empathy already, but empathy cannot go away. You just have to have boundaries around it so you can stay healthy too. Think of others, make sure my talents are available when they're needed, live in the present, hope for the future, spread that hope, and practice patience and certainly practice creativity. A lot of times it's not the skills that you currently have, but how well you can problem solve and learn new skills and creatively learn new skills to address situations. So I promised I was going to stop on time, so there was questions, but I'm going to just highlight a couple of things for you really quickly. I worry about how much our field over pathologizes trauma. Trauma is a part of life. It impacts all populations, some more than others, of course, and we know that because of the work that we do. We know that from the work of Whole Health Louisiana. There's a lot of trauma out there. We certainly want to reduce it, identify it, reduce it, but it's not going to go away. So I do worry about over pathologizing something that we all will have to experience in life. Help people, respond to people. All of that, how we do that certainly matters. Identify and limit the impact of trauma, but you're never going to take it all away. So helping people find hope, helping people find connection and support, that kind of stuff matters. And the work that you do matters. The fact that you are here, the fact that you're at this Lunch and Learn, the fact that you work in the state of Louisiana, where we know we have an abundance of people experiencing trauma, including all of us. The work you do matters. And I really, really do appreciate you. And I thank you. And I remain humbled to even be asked to do this presentation with you. So with that, I'm going to hush so y'all can ask questions if you want to.
Thank you, Dr. Phillippi, for that insightful and just amazing presentation. It made me reflect a lot about, my job and like the people in my job. And so thank you for that. And we are now opening for questions. So please put any questions that you have in the Q&A box, or you can even drop it in the chat. The chat is still open. So yeah, any questions that you guys have for Dr. Phillippi, I'm going to start fielding.
Thank you, Jill.
So while people are still thinking about their questions, I have one for you. Working at the Blanco Center, we do a lot of work in policy and things like that. And then, you work in policy and practice as well. So in your perspective and based on your experiences, how do you think not vicarious trauma, but trauma that workers get from, their jobs, social workers get from their jobs, from treating clients, people that are on the field in child welfare and things like that, having experienced trauma from other families, and things like that. How can we help and support our workers who are experiencing that trauma and that stress from their job at a policy level?
Actually it's a great question, and there's inroads being made. I briefly mentioned, but workplace wellness is a entirely growing field. And one of the probably going to oversimplify this answer, but we've spent most of our time in the workplace reacting, waiting for things to get bad enough where we have to recommend somebody for EAP or fire somebody or put them on some kind of, uh, supervision or some other assistance versus being very proactive in the workforce and realizing that wellness is something that we can do by creating an atmosphere in the work we do, of appreciation. A lot of y'all mentioned exercise and walking and things like that. I know on our campus, we have people that get up and they have walking meetings. I think it's brilliant. I haven't done it yet, but I see them walking around campus meeting with each other, and I'm like, this is brilliant. We need more walking meetings. Having gyms. I know a lot of y'all said exercise as well. Having access to things where you can exercise, very modern, and modern companies that are paying attention to this. When you walk into those atmospheres, you can feel the difference when you see, the spaces that they create for people to hang out at lunch, to bring lunch, hang out, eat lunch. The spaces they create for people just to sit around and talk or sit around and read while they take breaks. That not everybody's not going to their small offices or cubicles, shutting doors and everything else, and just going through the grind and suddenly waiting for 5 o'clock and leaving. Um, Places that are paying more attention to proactive wellness, emotional wellness, physical wellness, and everything else, they have healthier, staff, they have healthier work environments. People report liking it a lot more. And there's actually Pennington has done some studies around workplace wellness. I know we actually one of our graduate students did, Renee Underwood, Dr. Underwood, did her whole dissertation on workplace wellness in Louisiana. I do think it's something that we could take more into both big P policy, like how do we make policy around workplaces at the state or regional level about what we expect, those experiences to be in a workplace, and also at the small P, those policies and procedures that we all have to follow. But bringing that part of the welcome package for somebody that steps foot into University of Louisiana Lafayette or LSU and says, this is what we expect of you to contribute to the wellness of this place, and this is how we do it. We need you to participate to make it all that much better. And putting that in policy goes a long way. That was probably a lot more long-winded answer than you were expecting, but
No, that was a great answer. Thank you. We have another question in the Q&A. Edward asked, what is an interesting example of the over-pathologization of trauma?
so that is, thank you, Edward, for that question. So probably the first thing that comes to mind, there was this interesting dynamic of the blessing and the curse of the ACEs study, the Adverse Childhood Experience study. Um, Phenomenal study, profound study. We learned a lot from what those childhood traumas can do to a person, none of which they chose for themselves. These were all things that were done to them. So a fascinating study. But as we looked at that emerge, people started taking it out of context. They started using the ACE scoring as a means for people to, basically, it was never designed as an individual assessment, but people were giving to individuals and saying, oh, you've got, you've got 3 traumas, 4 traumas, and look at all these things that you're now at risk for. And risk is just risk. It doesn't say it's going to absolutely happen. It doesn't say that just because you're at risk, you're going to definitely have those higher suicide rates, substance abuse rates, the higher mortality rates, the higher mental health condition rates of mental health conditions. All it says is there's an increased risk. And Edward, to answer your question specifically, I think we took that information on the ACEs, the adverse childhood experience, and we over promoted risk as a kind of very horribly written story of the rest of your life, which to me is pathologizing trauma. Um, is there a chance that things are going to be really disrupted because of trauma? Absolutely. Absolutely, not a doubt in the world. But oh my God, there's so many things that we can do to help you, to prevent that from happening. And if it's happening, to intervene, connect you with human beings, connect you with all those supports we talked about earlier, so that it doesn't have to become pathological kind of judgment of where you are because of what you experience, not by your own will. If that makes sense, hopefully.
That made sense to me. Um, anyone else have any other questions for Dr. Philippi before we close out for the day? Again, I'm gonna um re-announce that if you are completing the webinar for a CEU credit, for nursing, counseling, or social work, please do make sure you take the survey at the end of the webinar, and the link to that is dropped in the chat. The post survey is required for you to receive credit. Does anyone else have any other questions for Dr. Philippi?
When I will say the question about the slides, I will hit save on these slides and send them to you all as soon as this is over, and you are welcome to post them, send it out to the participants, whatever you'd like to do.
Okay, thank you. You can email them to me, and then I should be able to disseminate them to everyone that attended today.
Excellent.
Thank you.
Thank you.
Okay, well, if there's not any more questions for today, we are going to close out a little early, so you guys can, go take a walk or enjoy the sunny weather we have today. So again, I want to thank you, Dr. Philippi, for your great presentation. I found incredibly insightful. I know a lot of people here did as well. And I hope we can, take some time to take care of ourselves today and obviously in the future. And thank you, of course, to our ASL interpreter, Lisa Gill. Thank you again, as always, for your amazing interpretations for our webinar. If there's nothing else, we will end it for today. Thank you all for coming.
Thank you.